When a person comes in with complaints of leg pain, we have to evaluate the possibility of injuries that may occur to the bone. If you have a person who's doing high impact activities on a relatively frequent basis, or going from little to no exercise to a lot of volume of exercise, sometimes the person training for, say, a marathon is running fairly long distances, maybe too frequently, not allowing the bone to recover from the stress, then that can set up a person for stress injuries. Bone has a certain elasticity and can respond to stresses that it sees, but if the stress comes on too fast, too sudden, then it may not be able to keep up and repair itself, and then an injury involving the bone can occur. Sometimes the difficulties with runners are that they are fairly compulsive, and maybe they start feeling a pain. They may have to rest or stop for a period of time, and maybe after a week or two things do start to feel better. But then on returning, their pain comes back. If you have a fracture of the tibia bone, it may take at least a minimum of 6 weeks to heal, and sometimes runners will go through a few cycles of on and off having pain, and until the pain gets severe enough are they forced to stop, and then we can count the 6 weeks for healing. Some patients who have leg pain and we've ruled out stress fracture. Sometimes stress fractures are hard to see on x-ray initially. Sometimes we don't really see evidence for the fracture that is typical, like a small crack. Sometimes the only time we ever see the bone responding to that fracture may be 4 weeks later, when we see finally some bone being developed to help heal the injury. There's a spectrum between no injury and a fracture that, as you stress the bone, it may become painful. Sometimes if there's a negative x-ray and it's still not clear whether to advise a person to continue to run or not, an MRI can be used, and that can be a test that can be sensitive enough to make a stress injury visible. The other reasons people can have leg pain can be due to inflammations where the muscle and the bone connect, and we would call that a shin splint. Shin splints are maybe fairly common. Sometimes it's related to certainly the exertion of the muscle, and sometimes those exertions are enough to inflame how they connect to the bone. Sometimes it's very difficult to tell whether it's a shin splint or a stress injury. Many times with shin splints, it's not painful with lighter activities, but under some load, those muscles and that insertion can become inflamed. It is difficult to distinguish sometimes either because of the way the pain has manifested itself. Generally, when you have bone pain, bone tenderness, you have to suspect the possibility of a stress injury. If you kind of have pain on exertion with the tension of the muscle pulling, or a tenderness along where the muscle and the bone connect, then that may be issues where the shin splints may be involved. The only other possibility sometimes of runners and leg pain is sometimes runners can run enough that their muscles swell within compartments of the leg, and that can produce pain if the swelling starts to become significant enough that the pressure inside these envelopes for the muscles exceeds the entry of blood flow, and we call that condition compartment syndrome. So those are generally the three types of problems that can occur in the leg in the athlete, the runner, who may be experiencing leg discomforts.